All right. Welcome, everyone, to the Democratic Club of Sunnyvale General Meeting for September 21st, 2024. We've got about 11 participants online, and it's kind of a similar number in the room and a few duplicates. Some are on it in both places. All right. And we are recording this meeting. And so again, welcome everyone. It's been a busy day and it's a busy weekend. I know many of us and you were at the Sunnyvale State of the City earlier this morning. And and then we've got Caltrain happening, a bunch of events.
Basically saying, don't come to Lebanon. And if you're here, leave as soon as possible. The line that sort of jumped out at me was.
Thanks. Okay, and so the Democratic Club of Sunnyvale is committed to providing a welcoming, respectful, friendly, safe, supportive, and harassment-free environment for members and guests. The club expects all leaders, members, and others associated with the club to respect the personal rights and dignities of all individuals at the meeting to create a productive, inclusive environment for all. All right, my name is Crystal Wickham. I'm the president of the club, and just a brief overview of our agenda today. We're going to be having 3 different candidates for different offices. One is for the board of the West Valley Mission Community College District, and Paul Fong is that candidate, and he will be first. We will have 2 different candidates for the El Camino Healthcare District. And then we're going to be shifting over to talking about Measure Y and Proposition 5. And we've got presentations on those as well. And then we will be having a discussion about whether to endorse the candidates or not, and then voting, and then some announcements. All right, so I'm going to turn it over to Martin, to our political director, Martin Pine, to talk about the voting process.
Okay, so these are everybody we're interviewing today for endorsements is eligible for the fast track procedure. What that means is we're not doing a set interview like we usually do for endorsements. What we're going to do is we're going to have we're going to have, and this will be for each candidate. Candidates will have 5 minutes. Will have up to 5 minutes to kind of introduce themselves, say what they're doing, and why they want the club's endorsement. And then there's going to be and again, this is this is after each candidate. It's not chunked at the end or anything. Then each candidate, and then there'll be up to 15 minutes for club members to ask each candidate any questions they have, etc. So, so that's the process so that's how we will be interviewing the candidates. These are all, in the case of West Valley Trustee Area 2, Paul is the only Democrat running. In the case of El Camino, Carol and Julie are the only they're the only Democrats running, and it is a race where you vote for multiple candidates. So so the ballot form is going to say vote for up to 2, and that's because you can in fact vote for up to 2 in the actual election. You can actually vote for up to 3 in the actual election, but we don't endorse non-Democrats. After we interview the candidates and the candidates have left, there will then be our usual private discussion about the candidates, and you can speak for up to 1 minute on each race. There are 2 races, even though there are 3 candidates. And then and then we'll be voting, assuming a quorum is present, which I'm actually wonder which I want to double check today, but assuming a quorum is present, it requires 60% of the membership to vote to endorse any candidate. There are 2 ballots, and there's only going to be 2 ballots. There's a West Valley Trustee Area ballot, which is just, do we endorse Paul Fong, yes or no? And then there's a El Camino Health District ballot, which is just please put a little check mark next to the names of the candidates you want to endorse. If you don't want to endorse any of them, you can put a check box to no endorsement. If you put a box next to no endorsement and the name of a candidate, I'm going to assume you just want to endorse one candidate, and it's one you check the box next to. The forms are active. I've I've given people the links, so hopefully they can get posted in the Zoom chat. If you are in person, there are QR codes on all of the tables over there. You can point your phone at the QR codes and you can vote based on the online ballot using the QR codes. While the balloting is open, we ask that if you don't immediately have to leave, that you hear out the interviews and the discussion before voting. Are there any questions? Are there any questions online?
Appears like there's no questions at this moment. All right, so now I would like to welcome Paul Fong to our fireside chat here. And you have 5 minutes to speak. Martin usually does our timekeeping, but it's kind of loose. So there you go.
Thank you. I'm a lifelong Sunnyvale resident. We moved here when I was 8 years old, and it's North Sunnyvale that I'm really fond of. And I decided to build my flower cottage right down the street because that is I'm known as the backroom political. I also planted my politics here in Sunnyvale. And I have been doing politics here in Sunnyvale for over 50 years. And a couple of years ago, I received the Lifetime Achievement Award from the Democratic Party, the Don Edwards Lifetime Achievement Award, because I've done that and I've been there for the Democratic Party. I've started 6 clubs in the Democratic Party. I remember when the Sunnyvale Democratic Club was founded, and I remember when Tara Martin Millis became a Democrat. So I have a long history here in Sunnyvale. My goal in life was to become the ultimate Sunnyvale High School homeboy. And that's the way I think. I'm a down home kind of guy, and I've been involved with politics. I've built a lot of political pipelines for people, for Democrats, for good Democrats to follow me. The last one I built personally was the state assembly. When I got elected to the state assembly, I hired Evan Lowe as my district director and Patrick Aarons as my ledge director district. And so I built that pipeline for good Democrats, and I've been building good pipelines for good Democrats in Sunnyvale because most of the Democratic candidates that ran in Sunnyvale about 10 years ago or to about 40 years ago or 50 years ago used my office for their organizing. And so I'm a devout Democrat. And so now I ran for the Foothill De Anza Community College District Board of Trustees. I was for 15 years. I served for 4 terms, 1993 to 2008. And the reason why I did that was to bring cultural diversity to the district because they wanted to eliminate the ethnic studies department, which I was teaching part-time in. And so there's a purpose. And of course, I brought cultural diversity to the district, and I also empowered the trustees of color throughout the nation and to the state of California because I organized the tri-caucus of trustees through the ACCT, the Association of Community College Trustees, which serves 7,700 trustees throughout the nation. And the tri-caucus is consisted of the Latinx Trustees Association, which I was an executive board member of, and the African American Trustees Association, and the Asian American, Pacific Islander, and Native American trustees. The Native Americans wanted to join the Asian American trustees because they felt an affinity to Asian Americans and Pacific Islanders. And so that national one I bought, and then when I got onto the state board, state triple CT board, I did the same thing there. I empowered the trustees of color, and that I did the same tri-caucus there. And I became president-elect of that association in the community colleges because I know the community college system quite well because I've been teaching in it for 48 years. And so, You know, I know everything inside out about the community college system because of my commitment to the cause of community college education. And so when I served in the state assembly, I made state laws that helped the community college system and to keep it excellent. And that also, to keep it excellent, you need the faculty and the staff to support it to make it excellent. And the reason why I'm running for West Valley Mission Community College District Board of Trustees, because I was recruited by the Teachers Association and the faculty and the Classified Association because they're treated badly by the administration and the trustees. And I figured out why they're treated badly. Because they're making too much money. They're a basic aid district. They get it from property taxes. I pay a ton of property taxes in my property, and it goes to a portion of it goes to the West Valley Mission Community College District. They don't have to depend on a full-time equivalent student or staff to get their money, which is the Foothill De Anza formula. And because of the formula that they have, basic aid and property taxes, they have excessive amount of money. They have over $125 million in their reserves, which is bigger than their entire budget, and they put away $10 million every year. They're rich, and they use that money to oppress their workers because they do not give binding arbitration. They give binding arbitration to the building trades because they're stepchildren, and they go through contractors, and they're not as threatened by their own family, but they treat their family members like crap. And working conditions there are very poor, although they get paid well because they get a lot of money from us. The working conditions are very poor. And they recruited me to kind of change the working conditions a little bit to improve on it. And that's my mission, to improve the working conditions for working families, because I'm a labor advocate too. I'm past president of the South Bay Labor Council, and it's linked with the Democratic Party. And I reached the pinnacle of the Democratic Party too, as being the Don Edwards Lifetime Achievement Award winner. And so that's the reason why I'm running.
Thank you. All right, we're going to open it to questions. And for those in the room first, if you have a question, I will come bring you the microphone. Okay. All right. Bruce Payton has a question.
Thank you, Paul. Other than the labor conditions, what would be sort of top priorities for you for the district over the next couple of years?
You know, because they have so much money, they don't have to rely on the enrollment. And of course, they eliminate classes when it doesn't achieve the minimum of 20 students in the class. And they don't have to eliminate those classes. If they get close to it, they can keep those classes because they don't depend on that formula for their funding. They depend on property taxes for their funding. And so we need to maintain the excellence in our classroom by maintaining more classroom offerings. And it also keeps the part-time employees working because they need a 40% load to get health insurance. And of course, if they lose their class, they may lose their health insurance. And so that's all linked, it's all tied together. Excellence is tied together with the workers.
All right, other questions in the room? Guess I have a question. So there's other members of the board, and how would you work with those other members to make those changes that you're talking about?
Well, you know, Martha Cantor was a well-known chancellor in the whole system, and she worked for me at Foothill De Anza, and she called me a lightning rod for change. And so a lot of people are repelled against that lightning rod for change, but that's the way I'm cut out that way. That's why I'm made. And I'm a lightning rod for change. I have changed things for the better, I believe, over the 50 years that I've been involved with the Democratic Party. And so I know that there are two progressive Democrats in there that run that board. but they're not walking their talk. They're not walking the walk. They talk the talk. They talk just like me. They get it, but they don't walk their talk. And I'm just going to make them walk their talk. That's it. They're leading the board, and they can do it, but they're not doing it because it's easier to be complacent when you're rich. And that's the problem with that district. It's got too much money, and they're being complacent, and they're not making the changes that need to be changed.
Thank you. All right. Any other questions in the room or online? I see. Yes, Julia, go ahead.
Hi, Paul.
Hi, Julia.
Can you hear me?
I can.
Thank you for running, Paul. And I can say ditto to everything Paul said. I have known him all the years. I've known his work. I've worked in the back room of the Flower Cottage when I was running for council many years ago. I'm delighted to see you take this challenge, Paul. I'm just wondering how you're going to change the structure of those that don't walk the talk. I know you can't change without supportive votes. One person usually needs a majority of the board. Do you have a sense about how you can accomplish that?
Well, I'm going to state my case. It's up to the chancellor to make the decisions, and the chancellor runs that board because they hired chancellor. And if the chancellor doesn't do his job, I'm going to have to look for a new chancellor. That's the way it works.
Yep.
And I'm good at that too, and I will do that.
Thank you, Paul.
You're welcome.
Okay, thank you. Any other questions? Seeing none. Thank you so much for, yes.
Check out my website at votepaulhog.com. Please, thank you.
Right. We'll move on to the next race, which is the El Camino Healthcare District. And we have two candidates, and our first candidate is Dr. Summersville. And so we'll ask the other candidate to leave the room during this time. Yeah. Hello. Good to meet you. Good to meet you. Carol Summersell. All right. So yes, I'd like to welcome Carol Summersell to the club and invite you to give your 5-minute introduction and pitch for endorsement.
I didn't know I'd have that much time. I usually only get 2 minutes. I hope I don't ramble too much. So I am current vice chairman of the board. I'm current vice chairman of El Camino Healthcare District Board. And I am running for re-election because I'd like to continue with some of the quality initiatives that we've begun. And I really have a vision for the healthcare district to become almost like a blue zone. I have a lot of extensive experience in quality healthcare. When I was living in Cupertino, when I first moved here, I lived in Cupertino. I rented in Cupertino, and I was chair of the OBGYN quality department there, and also worked with the OBGYN Department of Quality at Regional. Then bought a house in Mountain View a couple of decades ago and moved my practice, I'm an OBGYN obviously, up to El Camino. And currently I am chair of the Quality Patient Care and Patient Experience Committee at the hospital. As such, I've looked at we have this Institute of Medicine guidelines where care should be, they call it STEEP, STEEEP, safe, timely, effective, equitable, and also, I'm missing one of the E's, safe, timely, effective, equitable, efficient, and patient-centered. And we go through a matrix, making sure that in the hospital, all of that is working to our benefit. But we really have not concentrated enough, I think, on the outpatient. And now much of our care is being done outpatient. And it's not been a real push to try to integrate that care because we don't have a lot of power over the groups that provide that care. You know, there's a lot of disruptors in the market, such as Amazon, and a lot of for-profit disruptors. And I think that if we were to convene some of those groups, we might be able to get like-minded quality measures to happen. For instance, with the Community Benefits Committee, we've brought together some of the groups who we thought really wouldn't want to talk to each other to see what were best practices outpatient. So I am running because I would like to continue my quality work. Some of the other things I've done on the Quality Care Council is we have targets we want to hit. And so I asked our medical staff to go back and find something, a target they're not hitting that has an equity lens, and to make sure they hit it. And as an example of one of the targets, it was breastfeeding. Our breastfeeding rates were horrendous, and as you know, breast is best. And we found that it had to do with translation services in our Asian population. And so we hired a Asian lactation consultant, and now our breastfeeding, we're going to become a baby friendly hospital because of that. That's one example. Another example is the infectious disease, the translation machine. We're doing a study right now. One side of the ward has translation machines, one doesn't, and seeing patient satisfaction, also outcomes with patients who have the machines right in the room versus those where they have to get them. So those are just some of the things I'm doing equity-wise within the community. This year, 2024, I received a commendation from the California State Senate for my commitment to providing quality care and also for my policy changes for women and children. I'm also on the California Medical Association. I'm a delegate to the Medical Association. So we lobby in Sacramento. Go measure Proposition 35 now, I think it's called. As you know, half of the children in California are on Medi-Cal, and there's a real access problem because since 1998, there has been no increase in the rates paid for Medi-Cal. So these children cannot get in to see a primary care. So they come into our hospitals sicker than anything, when really all they needed was to be able to see a primary care physician as an outpatient in a timely fashion, and then they would never get so sick. So I am running for the healthcare district because I think our board right now, we each have our strengths, and it's a nice combination. And that's it. It's a nice combination, and one of us knows the people to get things done in Sacramento. Well, I know quality, the other one knows finance. I think we're a good combination right now, and we really work well together. Thank you.
Okay, thank you, Carol. All right, we will take questions from the room. Yes.
Hi, my name is Carrie Levin. I'm a resident of Sunnyvale, and I also have a hearing disability. And you talked about the translation services being accessible to the clientele that comes into the system, the hospital system. Going back to pandemic days, everything was online and the accessibility was non-existent. There was no captioning on the medical providers' platforms. Zoom, that was one. Google, but the medical providers did not have accessibility for people who are deaf and hard of hearing and whose English is not the primary language. So there's captioning can be translated to many, many languages. I don't know if this platform is still being used through El Camino system, but it was something I would like to see if the district is able to address that, or did that fall within that district or outside?
Whether our translation services have services for people who have a hearing disability. Probably it does, because it has just about everything, but I can look into it. So we use a outside service for that. Yeah, I would have to look into it. Yeah, thank you.
All right, other questions in the room? Yes, Bruce Payton.
Thank you. El Camino Health has done some really interesting things looking at the intersection between nutrition and, access to, food security and health outcomes. I was just going to say, what are your thoughts on what you're doing so far, and what are the next opportunities in that area?
So one of the really interesting things we got to do this past year was we got to visit the various food banks that we give grants to. And when one of the food banks opened up their refrigerator, there was no protein in there. And one of the community needs assessments, big ticket items, that is a health problem is diabetes. And they had a ton of sugary stuff and starches and carbohydrates and not enough protein. And so that's one of the areas where it's important, and John Cowan, our head of community benefits, is looking into to convene all these groups to see what should we be focusing on. We don't want to actually direct them too much, because you don't want to be hamstringed by whoever's giving you the money, but we do want them to talk to each other. And so one of the ideas was that perhaps we could work to make some of the offerings a little bit more centered towards some of the diseases we're seeing more about. We just hired, we've been using the community needs assessment to determine the needs. They look at all of Santa Clara. So our district is not necessarily like East San Jose. It's a little bit different. So we wanted to know what is really needed around here. And so now, just this year, we hired a population health manager who's assessing the specific needs of our healthcare district to see answers to that sort of question.
All right, thank you. Other questions?
This is a political meeting, but since your expertise is in medicine, there was a editorial in the New York Times this week that was saying, a number of peanut allergies has been rising dramatically, and yet for years the advice to pregnant women and young mothers was avoid peanuts, which they now conclude causes peanut allergies, or to put it another way, that introducing peanuts very early builds immunity. And so, the point of the article is that, why has the medical community been giving what was known as wrong advice for so many years? Now, I don't know anything about medicine. If you tell me that's just bad medicine in that article, then, but so I'm wondering, I don't know if you saw that, but
I didn't see it, but I've been practicing long enough to know that when guidelines come out, that I kind of take them with a grain of salt if I've been doing things a certain way for a long time. And I mean, I don't know about the peanut allergy per se, but to give you an example of a guideline that I have in my field is that, we shouldn't we have very advanced maternal age patients now. I mean, I have two 50-year-olds. donor egg patients, that we should get that baby out by this day. This is the, or, and having practiced long enough, I look at the patient. I feel you really have to see the patient and not just the guideline. So I don't know too much about the peanut allergy thing, but a lot of these studies that are done, they're not randomized controlled trial. They are just anecdotal, and then whoever it is takes it and goes with it, and they're not well done. So it just depends on the studies. Yeah.
Thank you. Any questions online?
See.
All right.
Okay,
Well, thank you so much. Right. We'll transition now to the second candidate for El Camino Healthcare District, and that is Julia Miller, who is online and spotlighted. Thanks for being here, Julia. And you will have 5 minutes to make your pitch to the club, after which we will move on to the next item.
Okay.
And have questions.
All right. Thank you. Well, I moved to Sunnyvale in 1958. And I used to walk to Sunnyvale High School past the original Martin Murphy Jr. house. Then my parents moved. I lived by the Washington Park, so I grew up in that swimming pool. So it was really nice to see it refurbished after all these years. Then my parents moved out to the new housing area on the border of Cupertino, which is really San Jose, and I graduated from Cupertino High. I then went to work for Lockheed Missiles and Space Company, and I spent 34 years out there. I did take a leave after 2.5 years. 3 of us gals decided to tour Europe. And when I came back, I had 5 offers from Lockheed, and I went back there for the rest of my life. After it merged with Martin Marietta, they did a lot of shuffling around, and I had an incredible job offer to go work for a Fortune 50 member of a family. So I worked as a personal assistant for many years for her, and she passed away. And then I worked as a personal assistant for many, many different people, sometimes intermittently during a week for as many as 8 clients, including the CEO of Rome. Anyway, a former boss of mine, Congressman Norman Mineta, that passed this world last year, he told me I was wasting my talent being in somebody's home. So he encouraged me to run for city council. And when I was first asked, I said, no, I can't stay up that late, because some jobs I had at Lockheed, I had to be there at 6:30 in the morning. So it was a little difficult. Anyway, I was successful in my election and served as your council member and mayor for 8 years. And then I was happily retired until somebody bullied me into running for El Camino Healthcare District. And I said, no, I really don't have health as my background. Anyway, I won that election, and here I am, 12 years later. I was actually planning to resign this year. That's why I volunteered to be an at-large member for your club. But things took an unplanned direction. The 3 of us candidates, one of whom you just met, were all unopposed until the last day, because nobody wanted to come in, I said, well, I'm healthy, I'm energetic, I love what I do. I have a great relationship with the CEO, the CFO, and all the executive administrative staff. So I'll stay in. Then somebody that I asked actually decided to file. So the rest is history. So here I am campaigning and would love your support. I have been former chair as of last year, and vice chair. I serve on 2 committees, compliance and audit. I'm vice chair of that committee. I'm former vice chair of governance, and I currently serve on governance. I've also rotated into our executive committee and also our quality committee, which is where all the real patient care and quality metrics are discussed. I've also been I am the board liaison to El Camino Foundation. I've been very successful and the only board member that's been able to raise dollars for the hospital. I was instrumental in my friendship with John Sobrato. He helped me bring in his own 5 million plus his friend's 5 million and an additional million from someone. And then my personal other friends have been donating. So I can clearly say I'm responsible for bringing in $11 million in my 12 years on the board. Another reason why I like to continue my work. I guess I'm willing to answer any questions you may have. I don't want to ramble too much. Just let you know that I love my job. I have a decent relationship with all my board members. One is a little problematic, but otherwise, we all work together. In fact, Carol and I are driving to Sacramento. We're going to an Association of California Healthcare District conference together. And I served as the vice president of the Association of California Healthcare Districts and acting as chair of that district until it was just too much for me to do. But I gained a lot and I interface with all the other healthcare hospital districts in California. So I have a vast experience compared to someone that has put out some information criticizing our finances. I'm proud to say that El
Hey,
Camino
Julia, can we move to questions?
has not laid off any employees, especially during the COVID pandemic.
Thank you so much. Now we will go to questions from the audience. Do we have any in the room? Yes, Bruce Payton.
Hi, Julia. Bruce Payton.
Oh, hi, Bruce.
Wanted to ask you, sort of as you look through the issues that you think will be in front of the board over the next few years, what are some of the top priorities in terms of health, health outcomes that you would be focused on?
Well, that's a sensitive question. Our main focus right now is strategy. As I'm sure you're all aware, healthcare is a very, very competitive with lots of moving parts and dynamics, mergers, building new facilities, etc. Since our newest CEO, or current CEO, I should say, has been on board, we have transferred into a health system, El Camino Health System. So we have 2 hospitals and 12 clinics. And I'm focusing on getting a clinic out in North Sunnyvale. It's been in the works, but we haven't gotten to a finalization yet. We watch sepsis, Bruce, very carefully. We watch our mortality rates, all of things that move around. But I want you to know El Camino is an award-winning hospital. We were named by Newsweek magazine one of the best top 100 hospitals in the country. And we have leapfrog ratings like AA and AAA because of our finances. We don't like to brag about our finances, but we have a very large rainy day fund.
Thank you. Here's Peggy Brewster.
Hi, Julia. This is Peggy Shin Brewster. I saw you earlier.
Yes. Hi, Peggy.
And hi, sorry, I was called. We were having a private discussion about this, and then I was called away. So I kind of want some clarity on. You said like at the Democratic Club picnic, you were unopposed, and then you just said that you had tried to recruit somebody, but she did not file until the last day, and then now she filed to run against you. So
Well, she's actually running against all three of us because we don't run in a district. There's 3 seats and 4 candidates, so one of the 4 obviously will lose. So the 3 of us, all incumbents, excuse me, let me just kill that. All 3 of us were, well, actually, I think one of us was prepared. John Zoglin was prepared, but Carol and I weren't. We figured that nobody was coming in. But I actually have a text message from the person that joined and made 4. I've known her for 20 some odd years, and I have it in a text message. I asked her if she wanted my seat, and she said, no, I think you should stay in. So I don't know if that's something I should talk about on the campaign trail, but that's the truth. And I have been advised not to talk to her anymore. I mean, it's a done deal. When I was told that she had pulled papers and filed, I called her and she didn't call me back. And then about 2 weeks later, she sent me a text and said she'd had a problem within the family. And that's it. I answered that and said, oh, I'm so sorry to hear that. So
I guess I'm curious.
all I want to say. But I can tell you that she doesn't know anything about healthcare because I didn't when I was first elected, and I think it's crucial. Of course, I'm speaking for all 3 of us. It's crucial to have experience in this dynamic healthcare situation. That's a nice question. Thank you.
Thank you.
All right, others in the room with a question for Julia?
Do anybody in the room use El Camino for your healthcare?
My 2 babies were born there a long time ago.
Well,
Lots of people.
We just spent 158 million updating the women baby pavilion, the Orchard Pavilion, and it's absolutely phenomenal, actually. It's and the NICU units, so it allows the partner, the parents, both people, to stay in the room with the baby. It's amazing. I'd be happy to arrange a tour for anyone that would like to see it.
All right. Anybody on the Zoom that wants to ask a question? While we're waiting for that, Julia, I just want to probe a little bit on, you mentioned that there was one member of the board that maybe you didn't get along with, and wondered, like, assuming if you win this election, how you're going to maybe resolve that.
Well, it takes 2 to tango, but we are improving as time goes on. So I'm hopeful that that'll all smooth out.
All right. Any others in the room or online with a question? If not, we'll close that out. And thank you so much, Julia, for.
Yeah, thank you.
Yes. Okay. Let's see. We are a little bit ahead of schedule, but our next item on the agenda is to move to a presentation about Measure Y. Okay. Oh, yes. I see our next speaker.
I was going to say, do you want to do the ballot measures first, or do you want to discuss the candidates first? Because we might want to discuss the candidates right after we've heard them instead of lumping it all.
Yeah, I like that idea, Martin, because I probably need to disconnect from the call soon.
I was just suggesting we don't, if it's logistically more complicated, that we don't have to do that, but
I feel like people who they got a probably just make up things.
Just move forward with
okay.
thank you. All right, so we're going to go forward with discussing the two ballot measures, and then we'll stop the recording and have a discussion of the candidates and for the endorsement. Okay, so we do have Isabel Flameridge here.
Hello, how are you doing? Always good to see you guys. If you're having a sense of deja vu, yes, we are asking for support on our measure or the renewal of our tax measure. It is different to the bond because the parcel tax measure covers only staff salaries and teacher salary, while the bond can only be used for buildings and build things, physical things. So is yes. And it is the only way that we can get this amount of money. And it was created at the beginning to lower the size of the classrooms. And now we are using it to pay for at least 9 to 10 salaries of teachers every year. It is a renewal of the existing, it is a renewal right now of the existing bond that is due to end next year in 2025. And now it's going to be renewed every 8 years instead of every 7. Somehow that was every 7, which made it a very odd elective election cycle before. And with that, we can still count with this. We have a presentation that will come in at any minute, and it will show you the difference between our parcel tax and all the local parcel tax. Oh, there it is. Perfect. So this is what it is the renewal of $59 a year per parcel. So it doesn't matter how big the parcel is. Some of the commercial parcels may have, depending on a big building, may have 1, 2, 3 or more parcels. I'm not sure, depending of how your multi-housing building was done, is also, it might be divided into 1, 2 or 3, depending of how many parcels are there. But at the end is $59 per year per parcel. And these can be also waived for disabled taxpayers and for senior citizens, so they can opt out of this option if they want to. With this, what is the next one? And okay, this is the language. So I suppose, well, if we can take a few seconds to read it. It works like the bond that we have oversight committee, and they meet very regularly, and they get audits during the year many times and check that the money is used exactly as it is on the ballot. And it has been very successful until now. The next one. Okay, so in this, as you can see, this is how we are right now. We are keeping it at $59. These are our neighbors in the county. As you see, there are people like in Palo Alto, they have $905 per year per parcel, all the way down to our parcel, which is $59. We are just, as we build it already inside our budget, we just want to keep it for now. So for the next 8 years, this is what it will be. Then we'll see what happens in 8 years. So far, we are able to finance ourselves with only this amount. And we are confident that we are doing well. But if this amount is not passed by 2/3 of the voters, it's going to be very difficult for us to make up the $1.1 million a year. We are, although we are in a very good stand and we are in AAA budgetary, I mean the credit rating, we are going to make it, and we have some savings, but we are already expending more money that we are getting. Is just that we think that we're going to be okay, so that's why we're not asking for more. But it's not easy. So we are going to be in trouble if we keep having to spend more money out of our general funds, because there is no other way how we can make money other than with taxes and property taxes. So, and we need 2/3 of the voters say yes. Yeah, the next one. One of the main reasons also is that a lot of other measures are coming this year. And we don't want to overtax the people and the voters, so we don't want to have a higher one while we can still survive with this $59 for a few years in our prediction. That's pretty much it. Questions?
I'm Ambrosia Studley. Hi, Isa. Thank you so much. I had a parent who saw the same presentation at a PTA meeting ask me. I was kind of surprised because she was a little upset. And she's like, why aren't we asking for more money like all the other districts? You just showed us how all the other districts have so much more money. I know you answered it saying that we're just asking for what we think we need. But I don't know if you have the information, or what would your response, I suppose, be to a parent who would say that?
Right now, the town is also asking for other very neat measures like a library, and we're also getting our one library that just opened. We're gonna get hopefully another library soon. So we don't want to overdo it if we don't need it right now. If before the 8 years are gone, we do need more. After all this year, we are going to negotiations with our teachers. Although we already lost a lot of the one-time funding from COVID, we invested, we didn't lose it. We reinvested in a lot of things that were very needed for us. We're having way less money this year, but still, we believe in our quality teachers. We are very high in the local level of what we can afford to pay our teachers. So we trust them and our staff and psychologists. So this is very important to us to maintain this quality, and the amount of people we have, adults per kid per capita, which for us is very high, is one of the highest also in our county. But we think that we can make it for now. So maybe in 4 or 5 years, we'll see how it goes. We're going to enter right now in negotiations because our contracts are done at the end of this year. So we'll keep that in mind when we renegotiate all our contracts, because we do want to keep all our magnificent staff and great teachers with us.
Hi, this is Peggy again. I'm also on this committee, so I just wanted to chime in that it's really important that we vote yes on Measure Y. A question I am getting a lot is, didn't we just vote for something for the school district? And we did just vote for a bond measure C, and that was in March. And thank you so much for the community for passing that. It was actually, we passed it by about 70%, and that one only required 55%. But this parcel tax, my mnemonic is parcel people, like the same P sound, programs and people, while bond measures for like buildings. So this requires a 2/3 pass. So that is, we need to have as many as widespread support and more, and we're going to have more voters come out too. So I'm hoping that we will endorse today. And if you do, then I would love to get your name down as a personal supporter, as well as yard signs, if you can host that for us.
Yes. And we're also asking for donations because all our budget went into passing the bond. So we want to have some mailers and inform to the people what this measure is about and tell everybody what it is and buy more signs if we can. We're also very, very grateful of that part support, if it's financially support too.
Yeah, I had a question. So, parcel tax is people and programs, as Peggy just said. If this does not pass, would it impact class size, and by how much? And if it does pass, would class size be maintained or even improved?
Well, we'll try not to. We will try to make it, but it will be very difficult for us. In perspective, some people ask me why we don't just ask rich companies around to give us money, why we don't ask people for donations to have money on this. And the foundation, they work very hard. They pretty much beg every company to give us anything and give us money. The most that they've been able to have is about $200,000 in a very good year. And this is making a lot of calls, asking every parent who works in a company. So there is no other way for us to make up this money if we lose it with the parcel tax. It's not easy, and people is not giving away money for schools or education. So yeah, that's why we're asking. We pay for our schools with as neighbors and with our taxes.
Thank you. Yes.
There's a camera right there. I will try to be on camera. Eileen Blay, Sunnyvale School District. I will sit down. This is my son Button. So the parcel tax gets us about $1 million a year, and that is a lot, but it's also not that much. So what it comes down to approximately is about one teacher per school. The average teacher in any of our schools makes about $100,000. So if we do not pass this, we will lose about one teacher per school. We will try not to do that. We'll try to shuffle some kids around, try to maintain the class sizes that we have, but it would be very difficult, and we would very likely have to make some cuts to staffing.
Thank you, Eileen. All right. Any other questions online or in the room? Right. Really appreciate your presentation and educating us on Measure Y. Thank you. Okay, and next on our schedule is a presentation on Proposition 5, which is a state ballot measure. Yep. Okay. Well, let's do that. All right. Pam, please come into our, we've got two people. Yeah. Okay, good.
Good shares.
I'll let you introduce yourselves. And you can.
My name is River, and I volunteer with the Democratic Voting Center in Mountain View. Right here? Oh gosh. Okay. Yeah, my name is River, and I volunteer at the Democratic Voting Center in Mountain View.
And this is Pam, who's the center manager.
Yeah, hi, I'm Pam Salvatierra, and I am the campaign manager for the Democratic Volunteer Center. But that was kind of a mouthful. Anyway, thanks for inviting us here today. And the Democratic Volunteer Center was founded in 2010, and we had an office space for every 2 years since that time. And what our thought was when we founded the DVC was that we wanted to have in the Mid-Peninsula a large space with the infrastructure and the experienced staff to provide volunteer activities for anybody that wanted to help volunteer to elect Democrats. And so that's what we do. We have all of the resources that you need as individuals to come and learn about different volunteer activities. We also encourage you as a club or just as a group of people to come in and use the center, have events, hold your meetings, anything that you want to do. We consider this your volunteer center. We raise funds. We're totally volunteer staffed. In order that we can provide these activities. We have more than 60 phone bank stations. And by that, I mean we have computers set up so you don't use your own phone bank. You use our computers and they call into the different campaigns that we are, we change campaigns based on the day and our opportunity to get the calling list. But of course, it's all with Kamala Harris and Tim Walz in mind, and then the down ballots, because we know that if people vote lower on the ballot, they usually go up. Whereas in contrast, if they vote just for the president, quite often they don't go down. And in California, our ballots are like 4 pages long. So it can be a bit intimidating. So we have experienced people to help you phone bank, and it's really quite fun to do it in person as opposed to just at home, because if you reach a voter, we ring bells, we yell yippee, and anyway, everybody gets even more motivated. We also offer canvassing opportunities, and we do that in collaboration with the Bay Area Coalition, which is comprised of about 40 different groups of Democratic clubs and organizations in the Bay Area. Our focus is the California Valley. We have 7 House seats in California that we need to take back. And so California is almost like a swing state, if you will. As it relates to the House. So we can, if we win these California seats, retake the House. So it's critical. So we go down to Modesto, which is Adam Gray, Congressional District 13, and Rudy Salas, Congressional District 22. Now that's in Bakersfield, so we pretty much stay overnight. We have all kinds of resources to help families let you come and stay in their homes. I mean, it's just set up beautifully. We did not do that. There's no reason we have to mess with what the Bay Area Coalition has already set up, because it is fantastic. If postcard and letter writing are an activity you like to do, we also have those stations at the DVC. We can also provide you with the postcards and the letters if you prefer to do it at home. But what we like, guys, this is a huge center. It's 30,000 square feet. So you can get lost in it. So the more people that are there, the better, because numbers create enthusiasm. So bring your group in, come in the evening, have a wine party. We'll do anything to help you achieve your goals as a volunteer. And if text banking is something you like, we can help you get set up with that as well. That's pretty much an independent activity that you do. But if you had a group of people that wanted to text bank together, bring them in. We'll do it together. Let's see, what else do I want to say? We open the space for endorsed Democratic candidates. And our idea with that was that if we could fundraise to a certain level to have a building large enough to accommodate endorsed candidates, which we have a lot in this area, then we could help them defray their campaign costs by letting them do some of their campaign work in the center. So that's really exciting to do. And we have the plumbers union coming in to set up to set up for their walking that they do. And I'm not exactly sure for what race they're proposing to work for. Like I said, clubs, all allied groups, you're welcome to come in. We would love to have you. We hold a lot of events. We watched Kamala Harris acceptance speech, and that was really fun. Some people are discouraged from coming together as a group because they think they won't be able to hear anything. People be jibber jabbering. But I tell you, could hear a pin drop that night. Everybody was just focused. Then we had the presidential debate. People got a little bit more hoop and hollery, but I kind of would do the look. People want to hear this. So, and it was just fun. It's great. We served dinner. And then, so we'll have the vice presidential debate on October 1st. We'll open the doors at 5. The debate starts at 6 or thereabouts. And again, we'll have a light meal. So we're going to have we have educational programs that, again, provide more information for you and other opportunities to volunteer or to learn about particular candidates or what's happening and important programs or whatnot that we as Democrats would be interested in. So I think that's it for me. River, do you have anything to add? We do sell swag as well. So merchandise, you want to advertise what you feel and you support, because the more yard signs, the more decorations we have, the more opportunities you have to have a conversation with somebody. And, it's those undecided voters that we're after. We're not after the people that aren't on our team. We don't want to get in a fight with them. We're not going to change their opinion. They're not going to change ours. But this gives you an opportunity, and I've had it in grocery stores or walking along, good and bad. But please come to the center. We really encourage that. And go to our website. It's DEMVOLCTR.org. And I do have some handouts that I can leave. So any questions? That's important. 2460 East Charleston in Mountain View. It's the old Best Buy that's by the Costco. Everybody seems to know that. And they come in and say, oh, yeah, I remember what was over there. I remember what was over there. So it's big, great parking.
Hi, Ambrosia Studley. Somebody was asking where to get a Harris Waltz yard sign. Is that something we can get at your center?
The Democratic Volunteer Center.
Do you buy them or are they free?
Pardon me. We ask for a donation. We can't sell merchandise. So we work with a person that we've worked with for many, many years that does her own union producing. So.
Hi. Hypothetically, if I'm a Democratic endorsed candidate and and my house has stairs and one of my volunteers can't make it up my stairs, is the Democratic Volunteer Center accessible?
Yes, it is. It is. Bathrooms and everything. We have to be. Or that man that goes around finding people that don't have accessible spaces and they get in a lot of trouble. So yes, please come on in.
Other questions? What
Have
hours?
anything you want to say?
What hours are you open?
Right now we're open 12 to 4 every day. That will grow. We also on Saturdays and Sundays are going to be open from 12 to 2:30 and 2:30 to 4:30 for phone banking. And of course, postcard writing and all those things are always there. And then Wednesday night, 5 to 7 for phone banking. And when we get into GOT the week before, will be 8 to 8. So there'll be long days. But come on in. You can do what we do at the front desk. Do you have something to say?
Oh, yes. At the front desk, that's where I volunteer. Right now, it's 2 days a week. I'll be increasing it to 4 and also be the main point person for the front desk those days that I'm there. If you're volunteering at the front desk, it's answering questions, reading people when they come in, answering the phone, taking messages, directing people to where they need to go if they've come in to volunteer or want to drop in for phone banking or letter writing, etc. I had a interesting call the other day from a a Venezuelan expat who was working at Stanford, and he wanted to help sway the Venezuelan community in Florida. And so I got back to him with a couple of contacts in Florida that might be able to help him. But that's kind of the kind of thing we do at the desk. So thank you.
And River makes a good point. One of the things, anybody that calls, we want to make sure that we provide them with what they need or what they're looking for. So quite often we call them back after we've done some research to find something, because these are our people and we want them to volunteer. We want to help them achieve what volunteer activity they want to do. So thank you. Come to the DVC, 2460 East Charleston, Mountain View.
I had one more question, which is if I'm a single person and I want to volunteer, can I just show up or should I call first? And then alternatively, if I want to set up a group activity, definitely call first or just show up with the group. How does that work?
We accept drop-ins gladly. Yeah, no, just come on in. We'll find the space for you. It can be loud. One of the things that you'll see when you come into the center, because it's so big, is that there can be echoing. So if we're having an event, like I would have to speak very quietly, very slowly, so that it doesn't echo across the whole building. Plus, we've done sound mediation. So yeah, no, come on in. Come on in. We love it. Thank you.
Right. Thanks so much. And thanks for all of your volunteer work as well. All right. And we've got in person, we have the flyers and we'll also somehow show this online. Okay, great. Mike, do we have our other guest here or not? All right, are we ahead of schedule or a little bit? Okay. All right. Can we ask Ambrosia to talk about? Yes. Ambrosia, would you like to talk about the postcard party? Yeah. Speaker seat.
Oh, I'm in the special seat. I'm Ambrosia. I'm the new membership director for the club, and I got us 200 postcards for Swing States, which was a campaign that reached out to our club to see if we could help out. And being a membership, I thought we could kind of, I don't want to say capitalize on that, but like have a few events. Maybe you would like to come do some postcards and maybe invite a friend who is Democratic Club curious. So Gail Rubino and I are hosting an event. We have 2 different events coming up, and I'll send out probably an evite so we can get RSVPs. But we're going to do September 29th, which is a Sunday, 2 to 3 p.m. We decided tea time. It'll be at my clubhouse, which is closer to downtown. And then we're going to do October 16th, 5 to 6 p.m. here in this room with a little pizza. And it's the kind of thing you just show up. I have all the materials, and it should be really great. I think it's Tennessee and Pennsylvania. So I think that's going to make a real difference. So I'm excited about it and hope to see you guys. Yeah, so it's going to be September 29th, 2 to 3 p.m. October 16th, 5 to 6 p.m. Great, thank you.
All right, that's going to be really fun. Shall we just move to other announcements yeah. Okay. All right, I'm coming to you, Gail, with the microphone.
Hi, this is Gail. No camera, yippee. Okay, so on Wednesday, I think that's September 25th, Larry Klein will be here in the El Dorado Mobile Home Park clubhouse, and we're going to have pizza and soft drinks. So please come and say hi to Larry and his reelection campaign. And we'll get an announcement out on the Democratic Club too, but it's Wednesday, 5 o'clock. Come on over and talk to Larry and have some pizza and soda. Thank you.
All right, great.
Kristen, could I say what a nice thing for Gail to do?
For sure, yes. All right, anybody online have announcements you want to? We are still waiting for one of our speakers for Prop 5. So we're just doing announcements right now. Or any others in the room who have announcements?
I'll just say that I think the state of the city today was amazing. I was so proud of all the things that our mayor announced.
I'm Eileen Lay. I'm a Dems Club endorsed candidate for Sunnyvale District 6, but I want to say that one of the other Dems Club endorsed candidates, Pat Carpio for Fremont Union High School District Trustee Area 2, has some upcoming block walks. She's actually doing a block walk this weekend and also October 5th and October 19th. If you want more information about those block walks, if you want to volunteer, please visit her website, pat2fuhsd.com. There is a volunteer link there, and click that and sign up to walk. We need people getting out. Her opponent is a MAGA Republican, and we need to get her name on in people's ears and on people's ballots. I would also appreciate volunteers, but I don't have set up on my website. I'll get that done though. Thank you.
Thank you, Eileen. Others with announcements?
Kristen?
Yes, go ahead, Julia.
I wasn't sure if it was legal to give campaign conversations, but as I'm in this unplanned, unexpected campaign, I have 15 lawn signs left over from my former campaign. I threw all the others away. I'd be delighted to have someone volunteer to put one up. And Gail, I would love to be invited out to your mobile home park some evening, but I can't come on the 25th because Carol and I are in Sacramento for the conference. But thank you for offering to do that. Thank you, Gail.
All right, thank you. I just have one short, quick announcement. Caltrain is now all electric. Free rides on Caltrain the whole weekend, and there are a number of events. I think today, like starting a couple hours ago, there was an event starting in Palo Alto, and tomorrow there's a small event in Sunnyvale at 10 o'clock. Take a ride somewhere on Caltrain, all electric. All right, any other announcements? All right. And Mike, do we have our person? Not yet. Okay. All right. Should we wait or move on to the discussion of the candidates?
So we'd probably want to stop the recording for this, but we don't have to clear the room we don't have to actually clear the room if we do for discussion of the ballot measure. So if we're trying to fill time, I would suggest that we start by having the discussion and voting on the ballot measure because we don't have to clear, because we can do that without clearing the room. So if Neil shows up, we can do the vote. We can do endorsement for Y, and then if Neil shows up, we can do that, and then go to candidates. I think that would make sense. Yes, please.